You're listening to Health Professional Radio. My name is Wayne Buckler, and this morning my guest is Sam Easen of H1 Healthcare Group. Sam, welcome to Health Professional Radio.
Thank you, Wayne.
Now, Sam, H1 Healthcare Group's not a firm name that kind of tells me instantly what you do. Give me some idea of what geographical footprint you service and what products and services you offer.
In a nutshell, we provide workforce solutions and training to the healthcare sector in the UK and Australia.
Okay.
So our typical product or our typical service is contingent workforce into the healthcare sector. So most people would know it by agency staff. We provide typically nursing and non-qualified healthcare staff into hospitals, aged care environments, community settings in the UK and Australia. And we also provide online learning and training services to those organisations as well. In the UK, we also provide healthcare services directly to individuals in their own home, and that's an area which we will be expanding into in Australia as well.
And Sam, is it agency staff only for hospitals, or does it extend to aged care and other facilities?
No, aged care is a large part of what we do. So we've got a different profile in the UK to Australia. So in the UK, around about half of the agency staff we provide work in nursing homes or community care settings, providing care to the aged. And the other half would work in hospitals, typically in the public sector in the UK, the NHS. In Australia, the most of what we do is, around about 50% of what we do is private hospitals. And the rest is a mixture of remote Indigenous health, primary health, and aged care. So it's a good mixture of all of the different sectors.
Some of those are not the easiest sectors to provide services to. Remote and Indigenous,
No.
Would you say?
Yeah, absolutely. The whole point of the reason we exist is because it's not easy. Organisations across the world, healthcare, public and private, struggle to maintain an adequate number of nursing staff to meet demand. And if they could meet that demand, there wouldn't be a requirement for organisations like us. So the remote Indigenous side of the business, which is unique to what we do here in Australia, that is typically very difficult to cover for the organisations that provide those services, which are typically not-for-profit Aboriginal corporations or public health services. They are, by their nature, difficult to source and retain people to work in those areas. They require long stints of work in remote and difficult environments. So we are able to maintain a database of qualified and experienced nurses in that sector and deploy them at short notice for contracts of up to 3 or 4 months at a time out to these remote areas.
I see. Now, Sam, most of our audience are the clinicians of one sort or another, doctors, nurses, allied health professionals, mainly working in both acute care and aged care. What's the takeaway message that you'd like them to hear today?
One of the big misconceptions that has been prevalent and is prevalent in the healthcare sector generally, agency is a dirty word. Agency is one of those things which is generally and understandably it's a large expense, and most hospitals and most aged care facilities do use agency staff, but if they had the choice, if they didn't have to, they wouldn't. What we do is and what most agencies have to do actually nowadays is identify that you actually have to offer a solution to clients. So we here don't really refer to ourselves in the capacity of agency. We like to provide workforce solutions. When we're talking to our clients and organisations and nurse unit managers who are at the front line and who are suffering from staff shortages and therefore impacting on patient care, we want to work with them to help alleviate that through strategies to plug ongoing and foreseeable gaps in staff, which most organisations have, and to actually provide, therefore, a solution to them, which means they don't have to use agency or contingent staff in the long run. One of the problems of agency staff, and this is inherent, is that because they're not necessarily working in the organisation all of the time, they quite often aren't always well fitted into the organisation. So you get cases where you get a square peg in a round hole, and that is counterproductive. Agency staff cost more than regular staff do, and they quite often, because they aren't orientated into the organisation fully, can end up being the experience can be counterproductive, and the hospital will end up paying for it. What we want to do is try and change that and actually reduce the reliance on agency by providing solutions and actually putting in people who want to work in that hospital and who want to work permanently in those organisations, and to enable them to do that.
And Sam, a question without notice. Is there a secret sauce to your business? Is there an innovative edge that you pursue?
When we opened the business here in Australia, we had to do something different, and the innovation element of it was simply a product of going and speaking to hospitals and aged care facilities and asking them, do you use agency staff? If so, what works for you? What doesn't work for you? And what we discovered, and no real surprise, is that all of these organisations have a requirement for agency staff, and when they are short for a night duty, for example, they'll call around all the agencies, and the first one that gets back to them will fill the shift, and that person will basically be on the floor. What we decided to do is ask them, well, how can we make this better? So our secret sauce, if you like, is actually speaking to the clients and actually consulting with them to find out how we can help them solve their problem, as opposed to simply plugging a gap. We're actually helping them solve their problem. So I think the secret sauce is speaking to people and being consultative with them, and understanding that at the end of the day, they're trying to provide good patient care. And if they have to use an agency, then you're better to actually speak to an agency and agree a way of working which, at the end of the day, achieves the result which is required.
Sometimes it's the simplest things that work best, isn't it?
I think so, yeah. And I think our industry has been guilty for far too long of simply playing to the opportunity to simply, there's a problem there, there's an ongoing problem, and it's seen as an easy way to make a lot of money. But the bottom line is you've actually got to provide a good service. At the end of the day, you've got to provide solutions. Nurse unit managers, directors of nursing in hospitals don't have the time to look at this in any great detail. And so the industry has to come up with innovative ways to make it work for both sides.
Now, Sam, people who want to get in touch with you, what's the best way to do that?
Well, so we have a 24-hour telephone line here in Australia, which is 1300 call H1, and the same in the UK. We also have our websites, which is h1healthcare.com and .com.au.
I always get in trouble for this from putting phone numbers and websites to air without giving people warnings. So fair warning, pencils ready, listeners. Now, what was the phone numbers again, Sam?
So the telephone number in Australia is 1300 call H1. That's 225541.
And in the UK?
And in the UK, it is 0845 643 2610. And we operate a 24-hour service for our clients as well, so that you can call us at any time and we're there to answer the phone.
Okay, and the website?
Is h1healthcare.com and .com.au. That's H1 with a number 1.
So we'll look forward to people being able to get in touch with you if we've triggered some interest amongst our listeners somewhere. Sam, it's been a pleasure having you on this morning. I do appreciate your time because I understand you're about to travel off.
I am indeed, yeah.
Thank you very much for finding some time with us this morning.
Thank you, Wayne.
You've been listening to my conversation with Sam Eastman of H1 Healthcare Group. Now, that conversation is available on our website at www.hpr.fm as both a transcript and an audio archive. There's also an audio archive on YouTube. My name is Wayne Buckley. You've been listening to Health Professional Radio.